Well, nearly 70% of Americans will have high blood pressure at some point in their lifetimes. Yes, I said 70%. For 5 decades, doctors have been treating high blood pressure with pills. But now there is a groundbreaking alternative procedure being studied at Ascension, Michigan. It just got FDA approval and is available for clinical patients not seeing good results with medication, and it may revolutionize treatment in the future. Are you a ticking time bomb and not even know it? We went to Ascension Salon in Southfield to randomly check blood pressure.
So we're going to slide this in through your arm.
We brought in a medical assistant from Heights Urgent Care to get the real deal with the numbers. Now, do you all take good care of your blood pressure, your health? Everybody gets a physical every year?
Yes, twice a year.
Salon owner Rodney Howell says he never has a problem, but the reading told another story.
It's a little high. It's at 174/96.
So imagine walking around feeling fine and suddenly you drop and die from a heart attack.
My father had heart disease and high blood pressure. He died at the age of 40 from a heart attack.
Lou Martin's family has a history of heart disease and high blood pressure, but 50 years ago, no one knew. And just suddenly dropped.
Just suddenly dropped one afternoon.
According to the Center for Economic and Social Research, more than 35% of adults in Michigan have high blood pressure.
Hypertension affects probably 70 to 80 million Americans. It's very prevalent.
That's why for more than 12 years now, Dr. Shukri David has been leading clinical trials along with 12 other centers in the U.S. on different procedures to treat people whose blood pressure cannot be controlled with medication. Why is this so groundbreaking?
This is the first time we're actually able to treat hypertension with a catheter outside of pills.
It's called renal denervation. They use radiofrequency ablation. It destroys the nerves that connect the kidneys to the brain, and that regulates your blood pressure.
Now, this treatment is not going to cure hypertension, but it will make it so that you might not need 3 medications, maybe 2. Or you may not need them in maximal doses, maybe in lower doses.
For Lou Martin, whose blood pressure could not be controlled with medication and was on his way to a 4th pill, this was a trial he wanted to take part in. At what point did he raise a red flag?
When my blood pressure was 165/93 on 2 meds.
A year ago, March, Lou underwent renal denervation.
After the procedure, I was amazed that my blood pressure was in the low acceptable range on medication.
Great news for Lou, but for some of these men, the numbers we saw are a reason to remain vigilant.
I have a doctor's appointment this coming Wednesday, so anything that'll come up, I'll find out soon enough.
Dr. David says high blood pressure is a silent killer. Even if it's mildly elevated over time, it can cause organ damage, blindness, kidney failure, and heart attacks. Know your numbers. You can get your blood pressure checked for free at Heights Urgent Care once a month at your local drugstore, of course, with your doctor. As for renal denervation, Ascension, Michigan is number 2 in the country and one of the busiest and most experienced sites doing this very procedure.
Now, I hadn't even heard of this procedure before, so how long has it been around?
They've been studying it for 12 years, not just at Ascension, but 12 other centers across the country, but they do the most, number 2 in the country, and boy, oh boy, if that works and insurance starts paying for it, it will be amazing for other
That'll
patients.
be the key, right?
Yeah.
That'll
Get
be
that
the key.
insurance to
Nice
cover
to
it.
have options though, right?
Absolutely.
All right.